As we saw last session, there's going to be a transformation in how we deliver care to patients. Because of shopping in the exchange and the unremitting price pressure needed to keep health plans affordable, the health insurers are going to then work with doctors and hospitals to transform how they care for patients, to keep costs down and quality up. Providers are going to work really hard to integrate care across the continuum, from primary care to specialist care to emergency room care, all the labs and tests needed, to the hospital care, to care after hospitals. These networks of physicians and hospitals designed to facilitate efficient care throughout a person's illness are critical. They're called accountable care organizations by many people. And the Affordable Care Act incentivized these accountable care organizations. And since the passage of the Affordable Care Act, we've seen a dramatic rise in the number of accountable care organizations, or ACOs, as this graph shows. There are now more than 400 working with Medicare and working with private insurers. Now, the accountable care organizations, I actually think, are an intermediate species. Right now, today, we have a very fragmented healthcare delivery system. In most parts of the country, doctors don't work well with hospitals or with pharmacies or with home healthcare agencies. The accountable care organization integrates, again, across the continuum of care to have more integrated, coordinated care. And they're one step away from being integrated delivery systems, organizations that integrate the continuum of care and then integrate with the insurance function. So they offer insurance, they take in a premium, and they care for patients throughout their life and illness. So they have both kinds of integration of care, but integration of care with an insurance function. Integrated care delivery systems have a big incentive to provide efficient care, that is, high quality care at the lowest possible price, because that difference between the premium they take in and the price they deliver care is their margin or profit. So I see accountable care organizations, as you might say, Cro-Magnon man, on the way from monkeys to human beings. And the fully developed integrated delivery systems are coming. That's not just a prediction, that's actually happening today. So we see in Massachusetts, for example, Massachusetts General Hospital and the Brigham and Women's Hospital partners have already bought a health insurance arm called Neighborhood Health Plan, which is listed on the exchange. In Pittsburgh, University of Pittsburgh Medical Center actually has its own health plan and insurer. In New York, North Shore Long Island Jewish Hospital and Health System actually offered its services on the exchange, and in the next few years is going to directly contract with employers. In New Mexico, the Presbyterian System has directly contracted with Intel to care for 5,000 of its employees. In Arizona, Banner has done the same thing. And so we see these big provider groups and health systems developing an insurance arm and becoming integrated delivery systems. Now, in the next few years, they will compete directly with insurers. They will be listing themselves on the exchange. They will be trying to get contracts from employers. So in Boston, the Massachusetts Health Plan or the Partners Health Plan might compete with Massachusetts Blue Cross and Blue Shield. In New York, the Mount Sinai Health Plan might compete with Empire Blue Cross and Blue Shield. And in my view, these health systems with their insurance arm are going to have a competitive advantage. They are going to be better branded. People are going to be more loyal to them. As a matter of fact, recent polling, which asked Americans about their confidence in various institutions, showed that the American public's confidence in health insurer is slightly higher than its confidence in banks and Congress, but it's about 13%. Well, I assume most people are going to be more loyal to their hospital and health systems nearby, which they have good feelings to. Well, what's that going to do to insurance companies? How are they going to react? Well, I see three paths of evolution. First, some insurance companies are going to pretend that this trend doesn't exist, that they're not going to compete with integrated delivery systems from hospitals and health systems. Those health insurance companies, they're going the way of the dinosaur. They're going to become extinct. A second potential path of evolution is that the health insurance industry has a lot of skills related to processing claims and using big data to understand how better to deliver care, which patients are sick, how to become more efficient. And we already see insurance companies developing these skills, marketing them, and I think soon we're going to see them spun off as separate companies. For example, United Healthcare, the largest for-profit insurer, created a subdivision, Optum, which does this data analytics and claims processing and sells those services to employers, to hospital systems, to pharmaceutical companies, and others. But I think the most interesting potential path of evolution is the third, where insurers actually get into the market and begin working with providers and maybe even owning providers. The telltale sign is this story from 2011, where WellPoint, the nation's second largest for-profit insurer, actually bought CareMore. Who's CareMore? Well, they were a provider based mainly in Los Angeles and Arizona and Nevada that figured out how to deliver really high quality care at a low price. They cared for mainly Medicare patients, those are seniors, and they were able to deliver super high quality care, about 24% below the market in terms of hospital admissions, a very low number, 60% lower amputations of diabetics. And when they had patients in the hospital, they got them out much faster. The consequence is they had very high quality and their cost structure was about 24% below their competition. Well, why, you might ask, did WellPoint buy them? I presume to figure out the secret sauce for delivering this high quality, low cost care and then trying to spread it to their other providers. But WellPoint is not alone. We see this same trend in others. Optum employs 5,000 primary care doctors in 75 markets, thinking that controlling the primary care doctors is going to be key to controlling healthcare costs. And Aetna is establishing joint ventures with various health systems and health providers to offer more efficient care. So what I see is a confluence of two streams. Health systems developing the insurance skills they need to become integrated delivery system, and insurers working with health systems or even owning and buying health systems to become integrated delivery systems, all of them taking responsibility for the whole care of the patient, from primary care all the way to hospitalization and to the release from the hospital. That, I think, is the future, where Americans get their care in these big integrated delivery systems. I often call this the Kaiserification of American healthcare system. We're going to have more and more Kaiser-like organizations that are going to take total care of patients. So the transformation of insurance companies as we know them, either they go extinct or they become integrated delivery systems, is the third big megatrend. The first trend is the growth of VIP care for patients who are chronically ill and mentally ill, the flowering of digital medicine leading to the closure of some hospitals and the shift of medical care out of the hospital, out of the physician's office, more to home, and the response by insurance companies to partner with providers and hospitals and doctors to offer more integrated care that integrates across the continuum of care, from primary care to the emergency room to the hospital to care after the hospital, with the insurance function. The traditional insurance companies we have today, they're going extinct. Natural selection is going to run its course, and what we're going to be left with are large integrated delivery systems that can care for people all the way through their health care. Well, in the next section, we're going to see how employers and businesses respond to the Affordable Care Act and how they're going to change their offerings of insurance.